Okay, good afternoon again, everybody. After our conga line, I hope we're all full of energy, ready to keep going for the next couple hours. So now we're talking about NCD policy and programming, taking stock and informing priorities, national and regional perspective. And another favorite topic of mine, tobacco control. Now, as we know in the Caribbean, we're at varying stages of implementation, so it'll be very interesting to hear from the various countries. So we're going to start with a video presentation from Guyana, and then we move to the other panelists.
Distinguished representatives of the HCC Caribbean NCD Forum, I wish to convey to you warm greetings from the Ministry of Public Health in Guyana, and to congratulate you on the hosting of this event, which indicates the vested interest that you have in lessening the stranglehold that NCDs have on the people of our region. I would have loved to be physically present at this forum, which has been convened expressly to prioritize and accelerate the implementation of the World Health Organization, WHO's Best Buy interventions by CARICOM member states, with the vision of achieving our NCD-related goals. Regrettably, however, I am unable to attend this conference, but I wish to convey to this forum the progress that Guyana has recorded concerning the status of NCDs and share with you Guyana's experience in tobacco control, this being one of the avoidable risk factors related to NCDs. Guyana successfully passed the tobacco bill, which was assented to in August 2017. Further, His Excellency President David Granger launched the Presidential National Commission on NCDs in December 2017, attesting to his deep commitment to join the campaign against the scourge of NCDs in our region. The campaign against NCDs is a work in progress in Guyana, but for the purpose of the panel discussion, I wish to focus on the ambience during and after the passage of the tobacco bill. Colleagues, in order to fight the tobacco epidemic, measures must be taken to reduce the prevalence of tobacco consumption and exposure to secondhand smoke. This is precisely the very intent and essence of the Tobacco Control Act 2017 that was passed in Guyana. No doubt, you must be wondering about the climate in Guyana vis-a-vis the tabling and subsequent passage of the Tobacco Control Act. And with your permission, I will share this experience with you. During the reading of the Tobacco Control Bill, there was a small protest by cigarette vendors outside the National Assembly, while the local tobacco company mounted a media campaign to convince the president not to assent to the Tobacco Control Bill. They argued that the bill had gone too far and that Jamaica and Trinidad and Tobago had less stringent laws. The tobacco industry also paid large sums of taxes each year, and they played on the public emotion by spewing misinformation that the passage of the laws would infringe on civil liberties, would ban the sale of tobacco products, and would bar former employees of the tobacco industry from employment by the government. The Private Sector Commission also called on the President to refer the bill to a parliamentary select committee before assent, a move which would have eliminated the stringency of the Act. Colleagues, the tobacco company once again reverted to the same old arguments, claiming that they had not been consulted by the government in the process of drafting the legislation. We learned a very important lesson during this process of trying to pass tobacco control laws. That is, engaging the media early in the process has many advantages. We recognize that with the sensitization of media operatives over the years to the reason for tobacco control measures, the anti-tobacco control rhetoric was balanced. The manner of reporting sought to bring the public health perspective to the fore, emphasizing the ravages of tobacco smoke on one's health. This helped tremendously in raising the consciousness of the man in the street to the effects of smoking and secondhand smoke. Many people have begun to take ownership of their health, and I am so happy to let you know that during the discourse of the bill within our cabinet circles, 2 cabinet members became so conscious of the ill effects of tobacco on health that they immediately stopped smoking. Bravo, I say bravo to them. Now that Guyana has successfully put in place tobacco control laws, it is my belief that we can be the example and the catalyst of change for the rest of the region. As a region, we now have a great opportunity to make a collective move to build synergies in relation to the passage and implementation of tobacco control laws. Moving forward, we are working to establish a national tobacco control program within the Ministry of Public Health, which can operate for at least 3 years and then be integrated into the wider NCD program. Accordingly, we will build tobacco control capacity among the relevant government officials and agencies in order to ensure sustainability and long-term success of tobacco control. All of us, we are aware that the tobacco epidemic is one of the greatest public health threats of the 21st century. Hence, we as legislators can fight this epidemic with the implementation of effective legislation, policies, and programs. The ACC Caribbean NCD Forum has already shown its commitment and advocacy for the control of NCDs by convening this meeting. We are all appreciative of the challenges inherent in this campaign against NCDs. So I call on you, let us work collaboratively and constructively to protect our children from the ravages of cancer that the smoke of tobacco and exposure to secondhand smoke brings with it, and so make the Caribbean region a safe haven for our children, our family, and our people. In Guyana, we will maintain the momentum in order that our people can reap the full benefits of the tobacco control laws and be positioned to better manage the risks attached to NCDs. In conclusion, colleagues, I wish to state that the ACC NCD Forum has the full support of the government of Guyana, and we do envision a successful meeting where the objectives of arriving at a consensus on NCD priorities and best guides beyond 2018 will be realized. May your deliberations be fruitful, and may God bless our endeavors.
Thanks very much, Minister Lawrence, for that very, should I say, encouraging presentation. Because, you know, we all need to get there. We have examples of some success. We are happy. Now, I'd like to invite Dr. George from Barbados to give us his 5 minutes of presentation.
Thank you, and I don't have a PowerPoint, so I have to keep you awake somehow. So I'm going to present on the Barbadian experience and give you a few of my thoughts as with respect to tobacco prevention and control in general. I think the journey in Barbados, I would say, is patchy. There have been some successes. However, there have been some deadlines, etc., that we have not been able to achieve. We took a different approach to Guyana. We took a piecemeal approach where we did an additive approach to our whole tobacco program. And in 2010, we did prohibition of the sale of tobacco products to minors, which is in full effect. Late in 2010, we did prohibition of smoking secondhand smoke, and that is in full effect. Then there was a hiatus of about 5 to 6 years. And in 2017, we passed legislation on e-cigarettes. And then subsequent to that, we took the bold step of using the standard for tobacco from CROSQ, passed legislation which was signed by the Governor General of Barbados in 2017 on packaging and labeling of tobacco products. So let me pause and let you know how the industry can interfere. So after that whole legislative process took, about, I would say, 2 to 3 years, because smoking in public places took about 12, so we're getting better. Packaging and labeling took about 3 to 4 years. But however, after that long and arduous process, the industry went to not healthcare, but they went to a ministry in Commerce and Trade. And that Ministry in Commerce and Trade wrote the Ministry of Health requesting that we change the labeling standard from 50% to 50% because we had in our legislation calls for 60%. And after speaking and letting good sense prevail, Barbados remains, the legislation has been passed at 60%, and we need to work with our BNSI to make sure that persons in the industry know what are the legal requirements of Barbados with respect to packaging and labeling of tobacco products. Many countries in the region, and I know this as a fact, although they speak about comprehensive legislation, they have not touched on illicit trade, which is a treaty in itself. And there are few countries that have attempted to produce good documentation on how they will protect the public against advertising, sponsorship, and labeling. So these are some of my thoughts on how I see the tobacco issue from my perspective. And remember, my perspective is a perspective taken from not necessarily the HCC's perspective, but from more a government perspective. I've been a government worker for most of my adult life. And I think that the challenge we have in the public service is to retake back the public health agenda of our time. We have lost it, and I'll tell you the reason why. NCDs have been drummed out by many public health priorities, which are priorities. And these priorities are new, and many times these priorities are locally driven, regionally driven, and internationally driven. So for example, when we had the Ebola outbreak in 2014, my ministry paused for 12 months. And NCDs were no longer on the country's agenda. So it's important for us when we go forward that for a fragile region like us, and I will put to you that when we had the Zika outbreak and the chikungunya outbreak, those were the issues and NCDs. And why this happens? Because we have limited resources, well-trained public health staff, but we have to put our resources where the greatest threat lies. So that frequently results in programs that are priority that no longer become priority. The other issue, I think we should learn from our experiences rather than try to rank our experiences. So in the room, you hear what Barbados did vis-a-vis what Guyana did, etc. And I make the point because every 2 years, countries in this room are required to report their compliance to the Framework Convention on Tobacco Control. Barbados tries to do this on time. But what happens to those results If those results are just being used for ranking of the countries, it makes no sense. We need investment in tobacco prevention and control programs today. And finally, my other comment is if you look at the World Health Assembly meeting, which a few, not many, a few of you will attend in Geneva, Switzerland. This is the focal point where I would encourage governments to make the investment and try to do the pilgrimage, I call it, to Switzerland, where you really learn the issues of public health NCDs in a broader perspective. And I think that countries must try to have delegations represented. I dare say the Caribbean has been poorly represented. Some countries have not gone consistently for 2 to 3 years, and that's unacceptable. So I think the reason why our voice is diminished with respect to NCDs is that no longer we have the presence on the international stage as we used to. Thank you so much.
Thank you very much, Dr. George. I'd like to add to that the other thing that derails agendas is natural disasters. And this year we know what happened last year in the Caribbean, so that would explain some of it. I'd now like to invite Dr. Davidson from Jamaica.
He's putting up, okay. All right, so I'm going to try and ensure I stick within my 5 minutes. Okay, so in Jamaica, we started our journey maybe before 2000, but 2000 was a significant period for us, and these are some of the milestones. I just want to highlight 2000 was actually the first, when Jamaica first participated in the first intergovernmental negotiating body for the WHO Framework Convention on Tobacco Control. Subsequent to that, we had the formation of the Jamaica Coalition for Tobacco Control, which is a civil society group focused on just really moving this agenda forward. And then we had several other initiatives. I want to again highlight one key aspect, another key milestone in our journey was when we established this multi-sectoral tobacco control working group. Following that, this group worked straight through to what we now have in place is tobacco control regulation in 2013. So Jamaica ratified the WHO FCT in 2005. And as you can see, it took us several years before we actually had legislation in place. Specifically, I wanted to highlight that, in fact, in 2011, we contemplated putting in place a comprehensive tobacco control bill, but then decided to move towards utilizing our Public Health Act and putting in place a regulation. And that allowed the then Minister of Health, which was within his remit, to really put in some legislation. So we started with the regulation, and then we're now moving towards a comprehensive legislation. So we also in 2013 adopted and had passed by Cabinet a National Strategic Plan for Non-Communicable Diseases, which also spoke to putting in this comprehensive legislation. Again, under the then former minister, we also did a comprehensive assessment of where we were at with respect to implementation of the FCTC requirements. And then following that, we had the amendments to the Public Health Tobacco Control Regulation, which I'm going to highlight further as to why we moved from 2013 passing this regulation and then the following year having to amend the regulation. Oh, sorry. So where are we now? Well, with respect to progress, we have had some progress, and that has mainly been around the smoke-free policy, which the regulation was put in place, and also within the regulation, we are fully compliant with the graphic health warnings. But in 2013, when we actually put the regulation in place, once we had rolled it out or enacted the legislation or promulgated the legislation in legal terms, we had a whole outcry from the public, the industry. We moved from graphic health warnings of size 70 and amended the legislation to now have graphic health warnings of 60. And so we had, we also did change the, within the hotel industry, we also accommodated designated smoking areas. So with that public outcry, we did end up making some concession and changes to the regulation. And a lot of it was around the fact that we didn't consult, it didn't go through the usual consultation. But within the remit of our Minister of Health, as you can see, it took us about 10 years to actually get to a point that we actually had a regulation in place. And this was under the remit of the Minister of Health at the time to really make these changes. And we thought this was the best approach at this time to really protect our population. So these are really the two main areas which we have achieved significant progress. Whilst we haven't met the target for our tax, we have been consistently increasing our level of taxation on cigarette products. And in fact, our Ministry of Finance uses the FCTC as a justification, as ensuring that they comply with this public health treaty to raise these taxes on cigarettes. So we have actually had about 3 increases over the past 2 years. With respect to these main areas, this is where we have really progressed. I know here we see that we haven't done much about public education. And I must say that we have been working within the school setting to really do more education targeting youths in high school and primary school setting to increase awareness about the harms of tobacco use. So what is our success formula? So we were able to put in a regulation. We were able to increase taxes. We're able to get a multi-sectoral grouping in place. And I would say our success formula was political will. So political will is critical. Civil society advocacy, we could not have done it without civil society. So we had the Jamaica Tobacco Control, Jamaica Tobacco Coalition and the technical working group working together to really make it happen. Then we also had high public support. So through civil society, they were able to put in place opinion poll, and the public supported this, over 80%. So that helped to support the argument and technical cooperation. But within all of this, we also had development assistance. So we had a Bloomer project, we had dedicated persons in the civil society team to really support all of this happening. But all of this had to work together to really have what we call a success formula. And we're actually leveraging the same formula towards obesity prevention in a Jamaican setting. So what are the barriers? And I list really 2 major ones: competing priorities. Competing priorities internally. So at the time of the regulation, we also had chickpeas, the Ebola, and our natural disasters that we had to contend with, and that shifts attention and resources to these things. As a result, we had change in leadership. So over a short period of time, we had about 3 ministers, 4 permanent secretaries, 4 chief medical officers of health. And so each time you have a change in leadership, you also have to go through the process of resensitization of the team in order to move the process forward. So these were 2 of the major barriers. However, this year we have undertaken a major survey which will see where we're at with respect to smoking prevalence and other parameters. What is encouraging is that between 2010 and 2017, we have seen a reduction for the first time in smoking prevalence in youth, and this is a global school health survey. So this suggests that there must be something that we're doing right. However, exposure to secondhand smoke still remains pretty high, and some new data will be coming out around this, but there's still a lot of work to be done. So 2 critical steps, or 3, moving forward, we're going to be reconvening our National Multi-Sectoral NCD Committee. We have been focusing on the food environment with the National Food Industry Task Force, and we're also planning to move forward with a comprehensive tobacco bill, because our current law does not address TAX, which is tobacco advertising, promotion, and sponsorship. And what we have seen is a resurgence of billboards, advertisements, which were not there before. And also to complement this is our public education campaign. So let's continue to be NCDs, make the region tobacco free by 2022. Let's continue to make more memories, more life, and let's move with Jamaica. Let's take this challenge, you leverage experience to really tackle our other NCDs, because we can learn a lot of lessons from this. Thank you.
Thanks very much, Dr. Davidson. And now we have Mr. Farquharson again. We're really giving you a lot of work today. He will tell us the perspective from CROSQ.
Good afternoon again. I am set to preach the gospel of NCDs, and I must say that having had both of my parents dying from NCD, one from diabetes, one from a heart issue, I can preach the gospel of NCD because NCDs affect people, families, friends, co-workers, and so on. It affects possibilities that challenges us to achieve what we want to achieve. It affects our passion, and it affects our purpose. So I've just preached the gospel of NCD. The CARICOM Regional Organization for Standards and Quality in 2012 promulgated the CRS 26, which is a standard for tobacco standard. And Ms. Vanessa Nurse, sitting right over there in stand, was the person who initiated and worked with the Ministry of Health to promulgate that standard, which eventually was incorporated into the legislation that Dr. Davidson just spoke about. So that then was translated into the regional standard and became what we now have as the regional standard for tobacco, labeling of tobacco products. We had, as I indicated earlier, we had some challenges in implementing that standard, and the Guyanese representative actually brought out a couple of those issues to life. And but we are still setting the bar, using our stakeholders to engage into the discussion of continuing that standard for tobacco, reduction of tobacco use. And as we speak, we are harmonizing the the standard for advertisement of tobacco products. Now, Jamaica has led again in developing that standard. It is now promulgated here in Jamaica, but it is voluntary. What we're going to do, we have already gotten approval from the 15 bureaus of standards across the region, who forms the CROSQ board, to promulgate, use that standard as a base document to promulgate a regional standard for advertisement of tobacco products, which means that it indicates within that the tobacco companies will not be able to advertise tobacco products, especially where children can have access to it. And if we follow the Australian example, there will be no advertisement at all. That's where we'd like to go there. So we want to promulgate this regional standard, and we're hoping that it won't take the inordinately long time that we took with the other one, where we had literally hundreds of pages of comments from stakeholders. I'll leave it at stakeholders. And we want to implement it. The issue we have, though, is that when CROSQ promulgates the standard and is approved and quoted by the trade ministers, when it gets back to country level, the political will, again, that political will is very, very important. To have it implemented for mandatory use through a legislation or through at least a policy, that is where we are having the challenge. And we want to have that gospel preached to the right people again. But on the other hand, we also want to encourage, and we will continue to encourage through our network, to have the appropriate competent authority to monitor compliance and enforce the use or non-use of the use of the advertisement legislation for the non-use of tobacco products. And we want to have, our goal through this process is that we will have a reduction of tobacco use throughout the Caribbean, not just within particular member states. Thank you very much.
We have an epidemic of tobacco advertising in Jamaica in recent times, so we look forward to something being done about that concretely. I'd now like to invite Barbara McGaw to speak from the CARICOM perspective from the Caribbean Coalition. Okay, while I'm waiting, just wanted to say that I'm going to talk a little bit about the regional perspective. Of course, there are going to be very similar points that were made by our individual speakers. And, I would just like to thank the organizers, the Healthy Caribbean, for inviting me to speak on this matter. One of the first things I wanted to show you was, as you know, there are 5 countries that have already passed either legislation or regulations. And thanks to Professor Samuels, I was able to get the latest grid. I was going to show it. And of course, the grid looks at whether things have been implemented partially or not. And we have to say there's still a lot of not in terms of countries' implementation. Globally, the tobacco use is around 21% in adults, and around there are
5 times as many men that are smoking than women. In the Caribbean, our data is showing from the CARICOM strategic plan 2011, looking at 10 to 27% in adults and 10 to 25% in teenagers. So what are our efforts at FCTC implementation? Well, we had a lot of talks this morning about CARICOM's efforts, the Port of Spain Declaration. 2 important actions, one which Mr. Farquharson talked about, which was the CARICOM standards, but also in 2012, the Ministers of Health. Great. Right, so this is a grid, and as you see, not implemented is where, you know, we really need to have some work. This is just World No Tobacco Day 2009. We went through that. And we talked about the action. This was a billboard in Trinidad in 2009, World No Tobacco Day. They were able to actually get funding to look at the cost benefits. And so in efforts of FCTC, we talked about the Port of Spain, and we know the heads committed to implementation of the FCTC. But these were the 2. So in 2012, the CARICOM Ministers of Health endorsed a recommendation to ban smoking as a public good and a regional goal. Unfortunately, we haven't really met that. I won't go into the government, the CARICOM heads of government. We talked about that. So in each meeting, there was discussion about tobacco use, discouraging, and talk about moving forward the agenda for NCDs. And at the 10th, 2017, noting that it was 10 years, they recognized that they had not sufficiently advanced the recommended action. The governments, what you find is, and we talked about political will, the governments that have strong political will are the ones that have laws now, and they have been very, very supportive. Just to go back to this point that Dr. Davidson made, when there's a change of minister and a change of government, you have to start all over again, because the technocrats tend to move around, even though technically they should stay. They tend to move around, so you have to sort of reorient everyone. This is an award from the Inter-American Heart Foundation that was given to Suriname for their very, very strong tobacco law. So civil society effects, Dr. Davidson alluded to that too, that the civil society in the region, through their advocacy, have made a real impact in terms of tobacco control. For example, in 2011, the Coalition for Tobacco Control was able to stave off a plan by the government to grow tobacco, and again with our international partners' support. In Trinidad and Tobago in 2009, and also the JCTC in 2013, the Trinidad and Tobago Cancer Society did a lot of advocacy to help that law. And actually in 2013, there was a group of CSOs that the tobacco industry was actually going to halt the passage of the tobacco control legislation, but the NGOs were able to successfully partner for that. And you know, we act as watchdogs. We expose the marketing tactics and so on. So what are the challenges? We know that there's been slow progress. We know that the main issue is political will and tobacco interference. We need to really identify the barriers at a country level, because sometimes there's actually differences, and convincing the governments about the importance of implementing tobacco control measures. Article 5.3 of the Framework Convention is a very important tool, and it stipulates how government and their employees should interact with the tobacco companies. Now, we have been famous for naming and shaming, but I have to say, sometimes the governmental officers are not aware of the impact they have by working with the tobacco industry in that issue. Sometimes they're just not aware of the impact. And of course, the governments are expected to increase their domestic budget for tobacco. Another award at the same year by the Inter-American Heart, this was the Jamaican Ministry of Health and the Jamaica Coalition for Tobacco Control that got awards for their tobacco control work. And so we've talked about this, the lack of financial and human resources, intersectoral collaboration, and so on. The lessons learned, you really need that multi-pronged, multi-sectoral approach that Dr. Davidson mentioned. And civil society support is crucial to successful efforts.
And we really need to educate the policymakers about Article 5.3, because with that, that will help to safeguard policies from tobacco industry. And the advocates need to keep in pace with the current information and knowledge. For example, we had cigarettes, then we had e-cigarettes, then we have hookah. We now have something called heated tobacco. And there's a brand called IQOS. It looks almost like an iPad with a little thing, it's smooth, it's sleek, and so the tobacco is heated but not burnt. And the claim is there are less toxins and so on. It's, you know, it's new, it's jazzy. So, you know, we really have to be on top of it. Professor Samuels talked this morning about the importance of research, but economic research is important and often neglected component because the policymakers don't really understand the massive financial cost to society. So we really need to keep up the whole research and have multi-sectoral with different countries looking at the cost of inaction, so to speak. And of course, we talked about the media. So the next steps will be the full implementation of FCTC at a country level and inclusion of FCTC into the national NCD plans, and thinking that most countries do have that. Integrating the FCTC into the UN multi-country sustainable development network, and that has been done for 2017 to 2021. And it's the overarching framework for the common work of the UN systems, so that each of the UN systems put together what their objectives are as regards NCD and other indicators. And cooperation among countries with the sharing of experience and success. And I just want to finish with this photo of two strong and stalwart tobacco control advocates to the max. Dr. Hagley and also Peter Bangerter from the Heart Foundation of Jamaica. Unfortunately, they are both passed, but we do all our work in their memory. Thank you.
Just one point to make, that the awards that we got from Jamaica were from the Inter-American Heart Foundation, and we have Beatrice here representing. The boss has 3 questions.
So the FCTC speaks to, can I speak with my voice? So the FCTC speaks, yes, before the mic. In this legislation and whatever collaboration is the issue of contrabanding. And I don't hear this today, especially since tobacco is so addictive. And after we get through all of the legislation and we stop advertisements and we stop, people can't buy it anymore on the good market, they look elsewhere. So that's that. To see, what are we doing to help our smokers? Because I don't hear any of us talk about cessation programs.
Thanks. Yes, so we do have cessation programs, and in fact, we had a national guideline, and we were doing training even before we had a legislation in place. However, you do know that smoke-free environment does help to support or provide a supportive environment for those persons who have started. But we do have guidelines in place, and in fact, we have included the nicotine replacement therapy as a part of our VETLIS essential drug list, which is accessed in the public sector. And so we are really trying to strengthen that area. And we also have an agency that focuses on public education and cessation support. But more can be done.
So I got some data from PAHO some time ago, and some of it I understand, and some of it I'm a bit mystified by. So the part that I can wrap my head around is the figures with respect to the prevalence of tobacco use in the Americas. There is a significant gap between tobacco use amongst men as opposed to women. So it's 20.6% prevalence rate in men, but only 12.2% in women. What is alarming though is if you look at adolescents, boys, it's 13%, and girls, right up there, 12%. So this speaks to the feminization of tobacco use, and I can understand that, which is really alarming that this gap just doesn't exist when it comes to adolescents. The figures that I don't understand though is with respect to information PAHO got from some school surveys that shows that the prevalence of use amongst adolescents, and they're looking at children between the ages of 13 and 15 years old. In the non-Latin Caribbean region, the prevalence rate was 21.3%. That's almost 1.5 times as much as what is the prevalence rate in the region. The prevalence rate in the region of the Americas is only 13%. But in the non-Latin part of it, us, is 1.5 times more, and I just don't understand why we are so much more susceptible than the Latin part of Latin America. So I don't know if somebody could explain that.
The first thing we need to do is to make sure that countries have reliable data from themselves. That's critical, because policymakers too, for example, your Minister of Health is not going to be interested in the data from Latin America and non-Latin countries. He's going to want to know the information generated in the country. I would urge countries to try to move to that route. Now, when PAHO does a lot of this information too, it's based on projections, so they may not be actual figures. So they, because countries can't do surveys every year, it's too costly, and then we have to try to do surveys every 5 years. They make projections along the way, and the projections tend to be trending upward. So I would first say that countries need to have reliable data, and then we need to, the next thing we need to do is use the data from the English-speaking Caribbean, and then you move outward. So that then you have a picture of what your population of people in your who are similar to you. And you may be a bit more confident than saying the figures that you got. I don't know if anyone else wants to see that.
And I would just add that also the year of the data was shared. So I didn't show the adult rates, and I just showed you the data that I showed you was the data that we just acquired recently. So in adults, we were seeing a downward trend, and the same trends that you have highlighted, we've seen in the Jamaican context. But current data is also important for that. And hand over to the doctor.
Yeah, thanks. Those data actually global school health survey, and those are currently that what we did use all of the levels to 2000. Those actually, rather than as recently available as possible data, so this is actually a trend. We're seeing very high rates in adolescence, feminization, particularly Jamaica, of public school. So it's very, very important. And I think if you think that we have conquered tobacco, really important.
Last question, Marisha, somebody.
I had a question, and is it my turn?
Yes.
Okay. Thank you for the clear presentations. I would like to make a comment, however, on the presentation of Dr. Davidson, and mentioning the success formula. You started with a political will. I would like to comment on that it doesn't necessarily have to start with a political will, as we've seen in the tobacco battle in Suriname. That you can start with advocacy coming from the civil society, and then sensitize government to go along and see the urgency. But it was valid, helpful to see the different elements, but I would not see it as a sequential process, rather than it can differ, the sequence.
So just to clarify that it wasn't a sequential process. I know I had some arrows which really it's all of them together, working together. Right.
Thank you.
So to create that policy window.
Yes.
Yes.
Maybe
So
one
thank
more
you.
person at the back. My second boss.
Thank you to the presenters for a very enlightening presentation. I wanted to zoom in on a comment that Dr. George made, and maybe some thoughts, provoke some thoughts for us. You mentioned, for example, how do we make NCD prevention and control and our actions on NCD sustainable in the Caribbean region, where in 2014 we had Ebola, 2015 we had chikungunya, 2016 we had Zika, 2017 we had Irma, Maria, and conjunctivitis. And who knows what 2018 will bring for us. When those things happen, priorities shift, funding, human resource, everything shifts to address what are current emergencies. But we also lose sight on the disaster that NCD continues to remain. But because of the slow action, because we don't really sit until the data speaks, when you hear that 8 out of every 10 deaths is as a result of NCDs, that for us in St. Lucia, 73% of preventable deaths as a result of NCDs. But those are not as sensational maybe as Zika and chikungunya, because these hit a little harder because they're acute, they're in everybody's face at the same time. One of the things that we mentioned today was the stories, making those stories available and letting people know that NCDs touch lives, they touch the lives of many individuals. But we don't get those stories in the media, we don't see them very often. I know that I'm taking the focus maybe a little away from tobacco, but the point made was that how do we now make NCD prevention and control sustainable in a region where we have endemic threats that will continue to increase? We're told that this year is going to be, expect more disasters, more stronger hurricanes than what we faced last year. How do we then continue to make NCD a priority when there's so many conflicting priorities for us in the region?
Thanks very much. I think we have to end this session now. Thanks very much for all your comments.
So I just want to say, I think your point is correct. There's the agency of which is the 2-year annual meeting that tells you everything. The countries that go are Jamaica every year, Trinidad occasionally, and Barbados sometimes. That's it. The countries don't constitution one. So we haven't been able to, because of, these are expensive meetings. So the COP, there was a COP in Russia and there was a COP in India. And we missed both. And we will continue to miss, and the smaller islands will continue to miss out because they don't see the priority. They don't have the money to invest in selling a tea, and they don't think it's relevant. If we have answers to your questions, we will.
Yeah, just to quickly say, we need to look at NCDs not in a silo, but part of the bigger picture system. Because if you look at Ebola, if you look at Zika, if you look at chikungunya, if you look at the disability due to these diseases, who is most affected? What's propelling the high rates of disability? We have a sick population of NCDs, and on top of that, having Zika and Ebola is going to make the outcomes worse. So there's no program, there's no public health program now that's not impacted by NCDs. The number one reason for maternal mortality, at least in some of our countries, is indirect causes due to NCDs. So if you look at that, maybe we need to shift and frame our argument. So, because we're impacting on many of these conditions. So I think we need to look at it from a general holistic approach. Maybe that's what we need to do. And costing as well.
Okay, thanks very much to our panel.